Honorable Speaker, people who did not learn from the Buganda riots of 2009 are at it again, holding meetings in Bugerere and denouncing the Kabaka of Buganda and his institution with a claim that President Museveni gave Kayunga District to Banyala exclusively. Right Honorable Speaker, I would like to know from the Prime Minister if it is true that the President has given Kayunga District to Banyala exclusively and it is no longer part of Buganda Kingdom, that is under the Kabaka of Buganda, and two, what steps government is taking to stop people from making such reckless.
Right Honorable Prime Minister.
Right Honorable Speaker and members, this is something that I cannot comment on now because I did not get what the information she's talking about. I promise that I will engage the concerned so that if there are any acts that can disrupt our security and coexistence can be handled by the relevant authorities.
Honorable Lillian, woman MP of Singiro. I thought she would even.
Thank you so much, Right Honorable Speaker. I want to put this to the attention of the Prime Minister that in today's talk, Mbarara Referral Hospital is in the talk of the nation. But from the informed point of view, 50% of the patients in Mbarara Hospital are from Isingiro. And Isingiro is one of the biggest districts. We are having certain sub-counties and 2 refugee camps. We do not have a district hospital. Right Honorable Prime Minister, how can we do it? What can we do to have a district hospital in Isingiro that we can offload the overwhelming people in Mbarara Hospital? I beg to submit.
Right Honorable, I saw you, the Minister of Health in Mbarara, and I thought you were doing good work there. Prime Minister, have you delegated him to speak, to answer? She's talking about the congestion and the situation in the national referral.
Yes. We have plans to elevate some of the health center floors to hospital status, especially in the districts where there are no hospitals. And therefore, we shall prioritize Isingiro district, now that she has raised it. About Mbarara Regional Referral Hospital, yes, I did an impromptu visit to the hospital, and I toured it from 10 p.m. to 2:30 a.m. on the 11th of July to do an on-spot assessment on how the hospital runs, especially when we have not informed the authorities, and did made many observations, some of which have to be fixed by us in the government, but also others are managerial and action to fix the weaknesses which can be fixed immediately, and also as a government try to support not only Mbarara Regional Referral Hospital but other hospitals so that they can function much better. I pledge that we are totally committed to ensuring that we improve the quality of care in our health facilities.
Thank you. Honorable Rone.
Point of procedure, Mr. Speaker.
Honorable Rone.
Thank you so much, Right Honorable Speaker. Right Honorable Prime Minister, Bukede Sub-Region was invited in Soroti by the Vice President on matters of cattle restocking and rehabilitation. And it was included on the program. But I got surprised when the program started, they were excluded. May I know from you why Bukede Sub-Region was excluded from the cattle restocking and rehabilitation? Secondly, last time I asked the same question to you, I didn't get an answer. May I know from you? Every constituency is mandated to have a technical school. May I know from you, Right Honorable Prime Minister, when will Gogonyo constituency get a proper technical school? Thank you.
Right Honorable Prime Minister. In his question is quite loaded, if you know where the speaker comes from.
Right Honorable Speaker and members, the Honorable Rone is aware that I'm part of his constituency. I stayed in Palisa for more than 5 years. Right Honorable Speaker, the restocking program started long ago in the areas of Acholi, Lango, and Teso sub-region. And you are aware that last year, this parliament appropriated 80 billion for the same exercise. The money we spent last financial year was exactly that. Right Honorable Speaker, after spending this money, many other regions came in. I will inform the President. After that, he will guide on the next course of action.
Thank you.
For the technical school, I have the Minister of Education. He can always give a better...
Thank you very much, Right Honorable Prime Minister. It is true, according to our policy on our manifesto, we are meant to provide a technical school per constituency. But as government, as a ministry, we are as of now prioritizing having at least one to begin with at every district. As we continue getting resources, then we go back to the constituency. I thank you, Right Honorable Speaker.
Thank you. Now, it is very hard. This job actually needs prayers. Can we, how do we handle all, and members, this House Speaker is supposed to be swarmed with many letters, I can hardly read. You see, I'm getting overwhelmed, and you don't want to. I thought we should be orderly. There are people who are here, they send me, that please, I want to speak. Now I have people whose names have been here from the other day. It is not fair for you to harass the speaker. Honorable Mohenda Ronald, Fort Portal.
Right Honorable Speaker, my concern was in regards to an unsustainable model that we are adopting, especially with the Ministry of Health, of promising hospitals, drugs, staff, and everything. I feel like it is within the reach of the ministry to again bring on board healthy inspectors. I feel like that is where the story of a healthy society starts from. It does not start with hospitals, drugs, and doctors, because it is not sustainable. But healthy inspectors, VHTs, must be brought back on board again. It doesn't make sense to encourage our constituents or our people that it's like we're promoting people to fall sick that.
Okay. Right. Honorable Minister of Health, dispose of within a few seconds.
Thank you very much. Right Honorable Speaker, the disease burden in Uganda is constituted of communicable diseases, non-communicable diseases, and neglected tropical diseases. And our approach to managing them is one, disease prevention and health promotion, where he's saying we should strengthen the community health system. We have VHTs, the village health teams. We are now training community health extension workers. We have health assistants at sub-counties and health inspectors. I think the point he's raising is that we should strengthen the prevention part. But that is not meant to undermine clinical and curative services, because even if you prevent, there will be those who will fall sick. And therefore, we have to simultaneously strengthen the prevention, but also put measures to treat and manage those who come to hospitals. So we are having a double-pronged approach, prevention, but also treatment